with me. And my name is Elsa Marie De Silva, founder and CEO of Red Dot Foundation. And you can check out my previous episodes on elsamariedesilva.com. But as you know, I do these Sunday reflections because we are still in lockdown in Mumbai. Seems like it's going to be a long road to recovery. And during this time, I invite one of my friends from one of my networks to come and share what they are going through, how they are coping, what inspires them, what motivates them, and also their perspective on current times. So today with me is one of my closest friends, Madhavi Misra. She's from my Chevening Gurukul Fellowship, and we had a blast in Oxford 3 years ago. Welcome, Madhavi. How are you?
Very well. Thank you so much, Elsa, for having me on board on this one. I'm really looking forward to this conversation. And nice to see you again.
Yes, it brings back a lot of wonderful memories. Madhavi, you're a public health expert and you've spent decades in this sector. This is a very interesting time. The pandemic, which has crippled the world, brought us to our knees, changed our life forever in many ways, and exposed the fault lines in our governance systems. What are your thoughts about it?
Yes, Elsa, our generation and our parents' generation and our grandparents' generation, none of them have actually seen a pandemic such as this. It really has brought us to our knees. It also exposes how weak the governance systems are, how weak the public health systems are. And especially in India and in developing countries like Brazil, India, how Indonesia, many of these countries, we see now how important it is to now invest in public health and to continuously invest in public health and to increase public health spending. I think the public health community in India has been asking for investments in public health for the last few decades. And our public health spending hasn't gone up more than 1.3% of the GDP. I think the time is now right to invest in that. There have been many key lessons learned. We have seen from states such as Kerala, they have robust public health systems. Tamil Nadu has a very good public health system. Delhi has been improving its health systems over the last few years. There's a lot to learn. I think making cadres for public health emergency response is one of the lessons that we've all learned. And I think generally, other than the public health community, the importance of healthcare and the importance of health infrastructure has become so known to the common man. Like there are the common person who was not bothered about how much we are investing in health, what the government health system looks like, do we have enough beds, do we have enough ventilators. These have become dining room discussions. People are now actually talking about these, about ventilators, about beds, about oxygen. These are very basic questions. So I'm actually glad that these conversations are taking place. But also I think it's a wake-up call to a lot of us, especially people in power, to sort of now take this very seriously.
Thanks for giving us that overview, Madhavi. Can you share how this pandemic and the way we've responded to this pandemic has really set us back?
Yeah, I think it has set us back. Some experts say at least a decade. For instance, all the effort that had gone into maternal and child health, for instance, the routine vaccination, the routine care for contraceptive, the availability of contraceptive care, the availability of safe abortion care for women in rural India, strengthening of some of these routine healthcare systems that people had been trying over the last couple of decades in most parts of rural India, have all actually come to a standstill during the lockdown period. I mean, now they're sort of getting back to life now, but for those 3 months, everything had come to a standstill. And these have disastrous effects. Imagine if women can't access abortion care services. Imagine when parents can't access vaccination services, So these these actually set us back a few generations. These have disastrous effects. When vaccination stops, when contraceptive stops, when abortion care services stops, routine care and hospital stops, because everything was diverted towards COVID care. I think it was also a knee-jerk reaction, in my opinion. We should have been better prepared. We should have had a cadre separately prepared to only take care of COVID while the rest of the health systems continues. People still fall sick. People still have babies. People still need vaccines. People still break arms. People still have accidents. That doesn't stop. So I feel like some of it was a knee-jerk reaction. I think lessons learned, and it has definitely set us back in time. I think it will be more challenging.
Madhavi, you actually point out, to some really important points about people still fall sick. And now it's a situation where if you go to the hospital for a routine checkup or your normal, medical treatment, you might come back with a COVID-19 virus. So what does it really say? First of all, yeah, our systems are weak. But take Delhi, for example. Before the COVID-19 episode, we saw that they were talking about reforming the healthcare sector, just like they did with the education sector. And has that really helped support this effort during this situation? Or, we still need a lot of work done with the mohalla clinics and all these other reforms that they've done? Can you share a little bit about it? Because in Bombay, we are not really, we don't really know what's going on in Delhi. We don't even know what's going on in Bombay sometimes. But I think the BMC has tried its best, and the way they've handled Dharavi, maybe it has, there are lessons to be learned from there, but I think time will tell. But maybe you can share a Delhi perspective.
Sure. I think Delhi's health system has been ramping up over the last few years. So it's not an effort which was started in mid-March this year. So Delhi's effort started a few years ago with the change in the government. I think that one of their agendas was to strengthen in Delhi's public health system, and they started by setting up the mohalla clinics. There's been a lot of criticism from various parts about the mohalla clinics, but actually, if you see the system, it's running very well. It's actually reducing the load on the big hospitals. So there was no first port of call, right? If somebody fell sick with a regular flu or a regular cough and cold or a small injury, went to the biggest hospital in Delhi, which was either Safdarjung Hospital or AIIMS, right? There was no first port of call where people could go. These mohalla clinics they created a whole range of hospitals, like I would call them sub-centers or small clinics, where people could go. So the bigger hospitals did not get overburdened. I think for routine care, mohalla clinics are very good. But in times of pandemic, they have also been tested, because people who've been running the mohalla clinics are regular doctors and nurses, and I'm not really sure if they were equipped with general equipment to take care of something like a COVID pandemic. I remember seeing one TV show much early on where they interviewed somebody from a mohalla clinic, and she herself said that there are lots of cases around here, but we don't have enough protective gear, which is the reality for most places. Another thing, and this was a good lesson actually, though you have set up a mohalla clinic, but they did not have enough protective gear. Another thing that the Delhi government did, which I think is very commendable, is that they started this thing of routine of home care. So they said that people who have moderate, or either they're asymptomatic or they have mild to moderate symptoms, they should remain in home quarantine, and we would provide them services at home. So please, you tell us that you have it, you get yourself tested, and we are going to send you care at home, including oximeters, including oxygen. I know people who had COVID who were doing home quarantine with mild to moderate symptoms, they were being given at least 4 to 5 phone calls every day checking on them. And I'm sure this is the case for most other state governments. I'm not taking it away from them at all. So I think this was a very good model. And other states have also learned from this. For instance, UP has learned from this. UP earlier, Uttar Pradesh, had everybody was being taken to hospital, but now only those who require hospitalization are taken there, because I think they have also realized there's no need to overburden the regular health infrastructure. You can provide the same care at home, and the chances of it spreading are then less. So I think Delhi has shown the way. I think Dharavi is an important example, though I can't talk about Dharavi so much because I haven't read up on Dharavi. But I think Delhi has also shown the way on providing home-based quarantine care. So I think that is important.
So we had, the CEO of Sneha, which works in Dharavi, come on Inclusive Cities, and she explained what they did, as in the BMC and NGOs and the other activists over there. So they created a lot of these little clinics within Dharavi where if you had any symptoms, go there and get it checked. And because initially there were 2 deaths on the same day, people panicked. So they then followed all the instructions. And whilst it's hard to follow social distancing, they still did their best. And I think that helped. So thankfully, we didn't have that much of an issue over there. But really, time will tell, because again, there are some who say that our peak is going to be in October. But let's talk about this healthcare system, especially the unsung heroes, who went and banged thalis and all that. But what about those ASHA workers? They get only 2,000 rupees per month. And they are the ones who really are out there in the front lines in all these small towns, going and providing the support to the medical system. And since you've been in this sector for a long time, pre-COVID, can you share a little bit about what you think is the reform that is now needed to strengthen these systems and not take for granted?
Of course. So I'm so glad you brought up the whole question on the ASHAs and the frontline workers, right? So just to explain to some of our viewers, we have frontline workers in our health system. So we have the National Health Mission, the NHM, within which we have the ASHA worker, who is a volunteer. She's a volunteer at the village level. And then we have the ANM, who's the auxiliary nurse midwife, and she's attached to a health center, and she's a government employee at the state level. And then we have the ICDS worker. She is the Anganwadi worker, but she's with the Women and Child Development. But anyway, these 3, ASHA, Anganwadi, and ANM, they're meant to be the frontline workers, right? And then there are some other in the cadre as well, but these 3 remain the main. And these 3 are the women. Okay, the most of the burden remains on the ASHA worker. A, she's voluntary. B, she only gets usually paid for every service she does. So if she takes 5 women to the hospital for delivery, she gets paid an X amount. If she motivates X number of women to get sterilization or to get an intrauterine device for family planning, she gets an X amount. So her salary is actually not fixed at 2,000 rupees, it's variable. If she enrolls people into TB treatment, she gets an X amount and makes sure that they get their TB tablets. She gets, a sum like maybe 10 rupees, or I don't know, I'm not sure, but she gets an X amount for every job undertaken in the month. Right, and then she maintains her registers. And above all, she does many other things as well. So she does contraceptive distribution. She motivates people for family planning. She maintains registers for women who have just recently got married. She makes sure that people go for their ANC checkup, for their postnatal checkups. So these are all these additional works she does. And she remains pretty busy, because I have traveled the length and breadth of this country. I have met hundreds of ASHAs, and they are the pillar of the health system. I mean, they are the first rung who are doing all this work, right? I mean, they have so much burden on them. There have also been a lot of conversations in the public health circle that there should be 2 ashas, in fact, not just one, because there is so much burden. It's not just maternity care. There's malaria, there's TB, there's HIV, there are so many other diseases. Now there's NCDs also. There's diabetes, there's cancer, there's HPV. There's so many other things, and mental health, cardiovascular diseases. There are so many other things that people have to think about. It's not only malaria and TB anymore. It's not only just childbirth. There's so many other things, and you can't overburden the ASHA. Having said that, in a pandemic, we have actually I would feel overburdened the ASHA and made her do this extra work of doing, sort of house listing. Well, anyway, some cadre had to do it, and they have sort of risen to the occasion, and we are very thankful to them because they have been one of our public health warriors. They've been our warriors along with our doctors and along with our nurses. They have also proven to be the warriors for COVID. However, it's been a very hard task because they also recently went on a strike because they weren't given enough protective equipment, right? And anybody would sort of, in their situation, would not do it for a small sum of money. It's not really about the money, it's about their healthcare. They have families to go back to as well, right? And we know how broken the health system is in villages, back in the villages, right? They are also exposing themselves from one house to another house. So I would definitely, if I had to clang a thali, I would definitely beat a thali. I would definitely do it for the ASHA workers as well, because I think they have been our frontline warriors in this fight.
We are very quick to criticize when they demand their rights, but honestly, we are asking a lot from them when they don't have the necessary knowledge or the equipment to do what they need to do. And I know in conversations which we've had before, you've mentioned that the state of those hospitals in some parts of the country are really pathetic. Like in neonatal wards, you have rats roaming around, and it's pathetic, right? Like a baby could be prey to any of these rodents. Do you worry that now, because of this mass migration of workers from the urban areas back into rural areas, that they would be carrying the virus and that they wouldn't have that the support or the assistance that are necessary to help them? Or is it that we were lucky that it didn't hit our rural areas?
No, I think it's already hitting our rural areas. Yeah. So it's but obvious that the migrants have taken back the virus back to their home states. It's not their fault. We kind of pushed them back, right? So we are the ones, not we, but the system sort of pushed them out of cities so that they went back to their homes because they could not earn a livelihood in the cities anymore. So anybody would sort of go back naturally to their hometown, right? So because they were pushed back into their hometown and they were in such close proximity to each other, that the virus spread, and it has sort of gone back into villages and rural India as well. I think the government is trying very hard at the moment to try and curb the spread. I feel personally it's a matter of time before it spreads into rural India. Knowing what the state of the health system is in most parts of the country, especially where the health system is very weak, the routine health system is also grappling every day, right? And it's a challenge, just in like, as you said, in the regular neonatal wards, right? It's very hard to find a clean bed. It's very hard to find a clean ward. There are very few examples, in some of the northern states at least. A pandemic like COVID is a double whammy. I think it's a double burden on some of these states. And I think the government should reflect at this point on how to deal with it, because if you speak to epidemiologists, and I'm not an epidemiologist, but if you do speak to one, it's a matter of time before it spreads in states. And if you already see in places like UP and Bihar, the numbers are rising. UP, Bihar, Madhya Pradesh, Andhra, Telangana, the numbers have been rising. So it could happen in the next month. It could take longer. but the population will get infected, right? So I think it's a matter of time. It's going to happen, and the health system will get burdened for sure. The rural health infrastructure will definitely get burdened because they are not equipped to deal with a pandemic such as this.
What does it say about our leadership? Because, and I'm not talking about political leadership, I'm talking about leadership in general, because this COVID-19 has really shown us that we may have a lot of smart and intelligent people, but a lot of people definitely lacking in empathy. What are your thoughts about it?
No, yeah, it's a very difficult subject, but I'm glad you brought it up because empathy is very few leaders have empathy, and I think to have empathy is a virtue. Like you just. There are very few leaders I feel nationally and globally who have empathy, and I'm talking about global leaders. I think it's important to think of all strata of society, all classes, before certain decisions are taken. I think because it affects everybody in very different ways, right? We saw it during the time of demonetization. It sort of everything went topsy-turvy. And during lockdown, I know I don't need to repeat it, but we know exactly what happened as the lockdown was announced. How if you and I were affected, in such harsh manner, imagine how we know exactly how the other people were affected. So I think it's been very tough. We have seen a lack of empathy. We've even seen it in the corporate sector. For instance, we've seen a lack of empathy even there with the way people have lost their jobs. Overnight. Just the other day, I was speaking to somebody, 2 days ago actually, I was speaking to somebody who works in an MNC in Gurgaon, which is in the neighborhood of Delhi. And she had just lost her job 2 days ago, and she was in for a shock because she said, I just didn't see this coming. So overnight people are losing their jobs, and people are still losing their jobs, and they will continue to lose their jobs. And it's not just the migrants. Unfortunately, they have very disproportionately been affected by this and very harshly been affected by this, but it's everybody who's been affected. And I think women have been affected even more, because I think gender plays a big role in this. I think between men and women, it always shows up, and I think you are a gender expert, I'm not, but it really shows up, and women always face the brunt of this, right? Because you have childcare to do at home, you have home care, you have to take care of the elderly, and you have to work. You have to at least want to try and work, and to do all this during a pandemic has been doubly hard on women. It's been extremely hard on women. Of course, men have stood up. They've been. I mean, I'm not making a blanket statement here. Of course, there are those partners who have stood up and the sort of burdened the responsibility at home. But by and large, it's been very hard on women as well. I mean, see the example of domestic violence. We've seen domestic violence shoot up during this time, right? And there's been no recourse. You can't even step out of your house. You can't even make a phone call. Where do you go? It's been very hard on women. So empathy, coming back to empathy, we see there's definitely a lack of empathy with our leaders, not just globally, nationally, but also at the workplace. People who lead us at the workplace have not displayed the empathy maybe that they should have.
Thank you for sharing that. And, the numbers definitely explain that women are at the receiving end of this kind of inequality and discrimination. You only have to go to Niti Aayog's SDG page and look at the numbers for SDG 5, and you will see the whole country marked in red except for Kerala and maybe Sikkim, that is in orange, which means that it's performing average on our own metrics for what is average. So, and maternal health, etc., women in labor force, all that is true. And we have actually, I'm trying to find the link. Since you brought up domestic violence, we filed a PIL in the Supreme Court of India to list domestic violence services as essential, simply because during a lockdown, women could not go to shelter homes. They weren't accepting them. They didn't trust the police. Sometimes the police themselves had COVID-19. When they did have the courage to go there, they've made them file an NC and return back home to the perpetrator. All kinds of stupid things which, make that woman and her children very vulnerable. So we try to get that done, but they asked us to work with the government on guidelines. So now we have to put some pressure through this change.org. So hopefully that should work out.
So important, domestic. I'm so glad you've taken that up. I think it's very, very important.
Yeah. So I'm going to find that link. But Venkatesh, who's been posting quite a few comments, has said, do you think having nursing and psychology as a part of early education system as a practical subject helps in addressing future mental health? With volunteering, can we address the need in the future?
Thanks, Venkatesh. I think it's a very important question you've raised. I think nursing and psychology in medical this basic training of I think at least mental health and psychology. I wouldn't say nursing, but definitely mental health and psychology. I think is a very important in our medical curriculum. I think mental health needs to find its place in the medical curriculum for this, also for our frontline workers, actually, for the ASHAs, for the ANMs, for the doctors, for the nurses. I think it's very, very important to find a mention, mental health, to find a mention in the medical curriculum across cadres. I think it's very important.
So, of course, a lot of industries and sectors have been hard hit during COVID-19, but the medical and the health sector is one of the sectors that I think the big four have identified as the ones that there will be a lot of investment in. How do you see this shaping up? Like, where will the investments, and not just in India, but all around the world, where will it be? Will it be in the jobs? Will it be in the equipment or the services? What is your thought, or all of it?
Okay, I think all of it. My answer would be all of the above. If I was a policymaker and if I had to invest in healthcare, I would invest in all four. Definitely in the human resource, definitely in the infrastructure, definitely in R&D. I think research and development is very, very important. We see that now, especially when we're trying to move towards a vaccine, right? India also wants to come up with its own vaccine. And I think it's very important to invest in ICMR, for instance. It's very important to invest in medical research, also to invest in private labs who've been trying to work. I'm very glad that, we are calling it the Oxford vaccine, then we are calling it, all other, Pfizer is coming up with a vaccine. But I think Prime Minister Modi's whole thing about Atmanirbhar should be taken to the last mile, right? If we have to become Atmanirbhar, we also have to invest in the country. We have to also invest in these institutions where we can make our own vaccine. If government institutions and if institutions which work on medical devices, for instance, or medical R&D are not funded enough, then we are going to face a challenge when it comes to times such as the SARS, right, or a MERS or an Ebola. When we actually need that vaccine, we need to not be dependent on other countries. Then we need to have that infrastructure where we can create those vaccines. And I think it's time now that we invested. So yes, if investment has to go up, I think in all fields. So R&D for sure, general like physical infrastructure, I think drugs and supplies, even supply chain has to be strengthened. Training, curriculum redevelopment, all these are very important factors.
We don't have enough of doctors, and the few doctors that we have for the kind of population that India has, they are also dying of COVID-19. So we really, really need to, fast track all of these things. And since medical training in itself is like such a lengthy process, we are far behind on the curve. But hopefully we will maybe they will reinvent themselves and figure out all these complex issues. So coming back to you, how are you coping during COVID-19?
So it's been hard. It's been hard on all of us. We have added responsibilities of care at home. So it's not easy. And I think your mental health takes a toll as well. I'm glad Venkatesh brought that up. But mental health takes a toll on everybody, right? And it gets harder and harder it got harder and harder for me, and I'm happy to admit it. As the lockdown progressed, life became harder. Though there was no shortage of stuff at home. I mean, we had rations, we had medicines, we had access to, healthcare. All of that was there. But just to be hemmed into the house and not have that opportunity to go out. We are social beings. Humans are social beings, and I think that became very hard. And not being able to meet people, not being able to go out, it became very tough. So one has to find ways in which to sort of, you read, you write. So I started writing. I started publishing some of my work in newspapers, in online journals, about what I thought of the pandemic, how it was being handled. Very recently, we also got a dog. So I think that gave us a lot of cheer in the house. I think many homes are now doing that. They're getting a pet. So I would encourage some of our viewers to think about that as well. So we got a rescue pup. It was rescued from a highway in Gurgaon, and then we got that pup. So I think it's important to do these things, and to take care of your mental health, and also admit it that things are hard and this will pass. And it's not just hard for you; it's hard for everybody around you. So I think to have this pretense of just being strong all the time it's not worth it. I think it's okay to admit that things are hard.
Yeah. And we don't talk enough of it. So I'm glad even today my team is doing on Instagram the whole day several things around self care. And I'm actually going on Insta Live at 6 p.m. So join me there. But since you work on public health and policy, and Venkatesh has a very interesting question on design, do you think that now policy making needs a reinvention in the way that we design, or we need more human-centered design in policy making, and clearly the pandemic has shown us that.
Of course.
Do you think that policy makers are equipped for this new way of thinking?
Yeah, I think that's very important. I think people have started realizing that you need to open our eyes to so much else, right? And policy needs to be human centric, right? It needs to be human centered, human centric. We need to have that humaneness in us. We need to look at things with some level of empathy that we spoke about. Policies need to be, we need to think about all our stakeholders. I mean, if you're building a policy on maybe roads or infrastructure or farming or agriculture or anything else, right? We need to think about all the stakeholders. How is it going to affect everybody, right? Not just the farmer, but how is it going to affect everybody else? So I think it's very important to have the humaneness in our making now. And I think people have also realized that how short life is, especially after this pandemic, and how important it is to sort of keep the humanness alive in oneself.
So when we did our Evening Fellowship, we were a mixed group of public sector officials, private and development sector. Do you think fellowships help? How did it benefit you?
Yeah, I think I'm so glad you brought up our fellowship time. So the Evening Gurukul Fellowship, I think, was a great time that I had, not just because I met all of you and such intelligent people from diverse sectors. I would not have met this group otherwise. And I would not have learned from my peers. I think it was a very important time for me in life to take that break of 3 months and be with like-minded people people with diverse groups, diverse, skill sets, diverse interests to learn from them, and also be in a university such as Oxford, where, learning is unlimited. So, and I think it's seen me through for so long, and I have these learnings which I'm going to carry on through life. It's just given me such different habits of being more curious, more, more wanting for knowledge all the time. I think it's been a great time, and when I reflect back and I look back at the time we had, it was a great 3 months invested, spent, and learned. Yeah. And I would encourage people to think about Chevening and other such fellowships that you have been on, actually, Elsa. And you've also your learning curve has gone up so much from these, and networks have been built, right? Not just friendships, but like professional networks have been built because of these fellowships. So I would encourage people to apply, yeah.
Absolutely. And right now, Chevening is open, as are several other fellowships. Do check them out and, figure out which ones work for you or not. What advice would you give your 16-year-old self?
I would say just live life, man. Just like live life, read, enjoy, just learn as much as you can. And also have that aspect of giving back to society. I think it's very important for younger people to understand that. If I was a 16-year-old now, one lesson I would teach myself is how to give back. I think I learned that lesson a little too late in life. But I'm still trying to imbibe it. But I think it's important to give back to society, as much as you can. It's very important to sort of share your knowledge and to give back. That's one learning I would give myself if I was a 16-year-old.
That's great advice. Thank you for that. Pay it forward, give back. And if each one did that, the world would definitely be a better place. And finally, what's next for Madhavi?
Oh yeah, what's next for me? I'm actually starting a new stint tomorrow. In the middle of a pandemic, I got into a PhD program at the Johns Hopkins University School of Public Health. So yeah, I'd applied last year, and I got in when the lockdown started, and I didn't know what it meant for me. So as of now, it's all online. So and it's great learning. I think these universities have aced themselves in online teaching, so kudos to them. So I've enrolled in the PhD program at the School of Public Health at Johns Hopkins, and I'm also beginning work with them. So I'm beginning a new stint with them as their senior program officer and one of their big and huge new project in India on strengthening primary healthcare, which begins, So we'll actually be working in 5 states of India to strengthen primary healthcare. And we should talk about it in the next few months, Elsa. They're like, watch this space.
Watch the space, and I hope, we are not still in lockdown mode, but if we are, you can definitely come back on my Sunday reflections or Inclusive Cities to talk about this exciting project. I'm really, really curious about it, but I think they couldn't have found a better person to help them with this project. I wish you all the very best, Madhavi. It was such a fun chat with you. Thank you so much for joining me.
Thank you, Elsa. Thank you. All the best to you too. Thank you very much.
Thank you. And thank you, everyone. Join me next Sunday, same time, same place, 5 p.m. Bye.